Hi, I'm Todd Kiesling. I'm a certified athletic trainer at Rejuv Medical. We're talking today about shoulder injuries, and we're going into rotator cuff tears and the different types of tears that there are. Now we'll talk about rotator cuff disease. So that comes from a process known as a degenerative change in the rotator cuff tendon. Rotator cuff disease is more common in individuals who are 40 years old and older, kind of like myself. Basically, a degenerative process occurs when the tendon begins to break down. Initially, the tendon thins until a small hole may develop. Then, if you think of a sole of a leather dress shoe, the sole gets thinner and wears until you get a little small hole. Then that hole gets bigger and it's dime-sized, quarter size, until it grows into a significant size hole. The size of the holes may vary in your rotator cuff when you have a rotator cuff disease kind of mechanism. One type of tear is a large size, and that's called irreparable. So there are small tears that sometimes don't need any activity other than maybe some rehabilitation. Other tears that are through and through may need a rotator cuff repair and a big surgery. If the tear goes too far and completely ruptures, that is where we get the irreparable or non-repairable rotator cuff tear. Not that there's nothing that can be done. Rehabilitation helps to increase function, and physical therapy can be a big part of the treatment. But generally the irreparable tears are not helped with surgery. And shoulder subspecialists, sort of like the ones that we work with all over the nation, really prefer not to do repairs on those tendons. Often this person has a decrease in their ability to lift their arm over their head, or they're unable to reach behind their back with their arm. That's a good reason to get a good diagnosis as soon as possible. So give us a call at Rejuv Medical, 320-217-8480.